Looking after your mouth after a dental extraction. After your tooth is removed. Pain relief. After your tooth is removed, the local anaesthetic used during the procedure will begin to wear off. To manage the pain, use an over-the-counter medication such as paracetamol or ibuprofen, which is available to buy from a chemist. Follow the manufacturer's instructions. Try to take this pain relief about an hour after the extraction so that it has a chance to work before the anaesthetic wears off. If you have any questions, ask your local chemist or pharmacist for advice. Do not take aspirin as this may increase the risk of bleeding. But if you've been prescribed aspirin by your local GP or told to take it, continue to do so. Pain. The local anaesthetic may cause your lip, chin and/or tongue to feel numb, so be careful not to bite your lip. You may find it a little more comfortable to sleep with an extra pillow under your head and a towel to catch any blood-stained saliva. The pain should ease after a couple of days and you may not need pain relief, but if you get a sudden increase in pain after a few days, this may indicate an infection or dry socket and you should contact your dentist. Bleeding. It is normal for there to be slight oozing from the socket or surgical area. The saliva may be a little pink. Take care not to poke the wound with your finger or tongue, as this may cause bleeding if the clot is disturbed. If bleeding occurs, apply a damp gauze or dressing that the dentist has given you to the socket and apply pressure by biting down on the gauze for 15 minutes to help clotting occur. Do not remove the gauze during this time. Brushing and cleaning. Brush your teeth as normal, but be careful and gentle around the extraction site. Do not rinse your mouth or spit out for 24 hours, as this can disturb the clot in the healing socket. Make sure you continue to brush your teeth for 2 minutes, twice a day with a fluoride toothpaste. Brush before you go to bed and at one other time of the day. Mouth rinsing. On the day after your dental extraction, please start to rinse your mouth with warm salted water as recommended below. 1. Mix 1 level teaspoon of table salt into 1 glass of warm water. 2. Rinse your mouth gently with this solution 3 times a day and also after meals, ideally after any food. Let the solution dribble from your mouth. 3. Try to keep the solution over the affected area of your mouth for 1 minute. This helps to keep the area clean and helps it to heal. 4. Continue with mouth rinsing for 7 days. Food. Avoid very hot, cold or spicy foods, as well as sharp or crunchy foods for the first 2 or 3 days. After 2 to 3 days, you can start eating a normal diet. Try to eat a healthy diet that includes 5 portions of fruit and vegetables a day. Drink. Avoid very hot or cold drinks for the first 2 or 3 days. Avoid alcohol, as this can encourage bleeding to occur. You can have a warm drink and food 1 hour after extraction. Smoking. Smoking increases the risk of infection and slows the healing process. You should not smoke after the procedure for a few days. Try to avoid smoking for as long as you are able to. If you need support to stop smoking, visit www.nhs.uk/better-health/quit-smoking. exercise. Make sure you rest on the day of your dental extraction. Avoid any strenuous activity which could increase your blood pressure and cause bleeding. Further guidance. Stitches. Stitches dissolve in 7 to 10 days. If the stitches are present after this time, gently rub them with some toothpaste, and this will encourage them to dissolve. Do not worry if the stitch comes out early. If the gum gapes or begins to bleed, contact the clinic where you had the dental extraction. Healing. The socket should heal over in a few weeks. If you have severe pain and/or bad breath, the socket may be infected and you should see your dentist. Dry socket. This is when the blood clot over the socket becomes dislodged, exposing the bone. It can increase the risk of food becoming lodged in the hole and increase the risk of a painful infection. You are more at risk of a dry socket if you do not follow your dentist's instructions after your extraction. You smoke. It was a difficult extraction. You had the condition before. For more information, please speak to the clinic where you had your extraction during office hours. During outside office hours, please contact NHS 111.